Hi, my name is Jessica Duncan, and this is my HPI. A 55-year-old male presents for an initial evaluation. He is here for the treatment of alcohol addiction. He started drinking socially after joining the military at 18 years old, and it increased with time. Prior to admission, he was drinking a fifth of whiskey a day. His longest period of sobriety was 11 months and 29 days after treatment in 2016 and relapsed on his wife's birthday. He has a history of verbal, physical, and sexual abuse in the military, as well as trauma when witnessing a ship blow up in front of him and friends dying. He has a previous mental health diagnosis of depression, PTSD, and generalized anxiety, and medical diagnosis of diabetes and hypertension. His current mental health medications include Buspar, Prazosin, gabapentin, hydroxyzine, and Seroquel. He reports depression onset at 18 during the military and denies any depression since leaving the military. He reports anxiety onset in childhood but worsened during his time in the military and is currently present daily for the majority of the day and worse at night when trying to sleep. He rates his anxiety an 8 out of 10. He reports symptoms of excessive, uncontrollable worry, ruminating thoughts, worst case scenario thinking, difficulty concentrating, a fear of death, a fear of others killing his children, difficulty sleeping, the inability to relax, restlessness, and muscle tension. He reports panic attacks 5 to 6 times a month, in which hydroxyzine seems to help. He also reports experiencing nightmares and flashbacks of his trauma and uses alcohol for avoidance and to help him sleep. He is easily startled and hypervigilant with a fear of going to sleep due to the nightmares. He currently is getting 3.5 hours of sleep per night with the use of melatonin and Seroquel, but states at home he also uses Benadryl. He denies any current or past suicidal ideation, homicidal ideation, audio or visual hallucinations. He denies manic symptoms, a history of eating disorders, any seizures or cardiac history other than hypertension. He also appears in no acute distress.